taking an extra second. Good afternoon, Ionia. We are live for another new episode of Brick by Brick, the weekly Chamber Facebook Live show. We are very, very excited today to be here with Carey Groendal. I hope I said that correctly, from Spectrum Health Pennock and Spectrum Health Integrated Care Campus right here in Ionia. So today we actually had to reschedule from about a month ago. So we've had a build up and we've been really excited to talk to you today. I know that we're going to be busting through some major midwife myths, and we are going to be talking about some of the services that are available to the women in our community through Spectrum Health. So let's get started. So again, we're chatting today with Carey Groendal, who has been a certified nurse midwife with Spectrum Health Pennock for about 2 years. She also, like I said, sees patients at the Spectrum Health Integrated Care Campus in Ionia. Spectrum Health Pennock is located in Hastings, and the Integrated Care Campus is right in Ionia. And so today we're going to be breaking through some midwife myths. So let's get started. Are you ready?
I am, and I just have to say I'm very excited to be here and have this opportunity to chat with you, Kat.
Awesome. I'm very happy to have you. Like I said, there was quite a bit of interest around the topic. So let's see. First myth. I have to apologize. I'm doing this from home today. My air conditioner is broken in my office and I had enough. So I came home and I thought the minute I start this, either the mailman's going to show up and my dogs are going to start barking, something's going to happen. Sounds like there's a garbage truck or something outside. So can you hear me okay? Uh-oh.
Yep, we're cutting out.
Oh no. What's going on?
All right, are you able to see me now?
There you go. You must have just had low bandwidth for a minute.
We're struggling with our internet service here a little bit today.
It happens.
Yes.
Mine was yesterday, so today's your turn.
All right.
So first, we bought ourselves some time and the loud truck's gone, so perfect. Sorry, folks. Thanks for being patient with us. But first myth, midwives have no formal education.
Yes, so this is a great myth to bust. Certified midwives like myself have a master's degree in science and nursing with the added specialty of nurse midwifery. We have extensive hands-on training in not only pregnancy care, but really for all aspects of women's health care. We are required to pass a national certification board exam, and we are also required to maintain yearly continuing education hours.
Wow. So that's great information to kick things off. What's the second myth? All midwives do is deliver babies.
Yes, this is a common misconception, and I'm still kind of surprised when I realize, how many people don't realize that we do so much more than that. So yes, the word midwife means with women. As certified nurse midwives, we are trained to provide care to women from adolescence all throughout the entirety of the lifespan. Of course, everybody knows we do pregnancy and birth, but we are passionate about all aspects of women's health care, including routine gynecological well women exams, reproductive and sexual health, perimenopause and menopause care as well, which are also huge transitions in a woman's lifetime. I became a midwife personally because I want to empower women to take confident ownership over their healthcare journey. It is my job as their provider to educate my patients and to help them make informed choices regarding their own healthcare.
That's awesome. So you certainly provide a full spectrum of services to women. Third myth, if anything goes wrong during my labor, there will not be a doctor around.
Oh, yes. So I would like to take this moment to kind of tell you a little bit about our practice. We have 3 midwives in our group, myself, Renee Gasky, and Jessica Travis. The three of us provide 24/7 midwifery care and coverage, but we also work very closely with our physician partners, Dr. Daniel Woodall and Dr. James Patingi, one of which is on call with us all the time. So when you're receiving care with us at our office, you're actually receiving a team of providers who are working together to care for you. And just know that a safe delivery for mom and baby is really our highest mission.
Which that is certainly wonderful for the community to understand. I'm going to apologize because the truck's back, so I will mute when I'm not talking so I don't cover you in noise. What's our next myth? Let's see. Number 4. Midwives and doulas are the same thing.
Yes, I see how this can be very confusing, especially if you don't have a lot of background in midwifery or doula care. So a certified nurse midwives or certified nurse midwives, CNMs, are medical professionals with extensive medical education and training. We are certified healthcare providers who can deliver babies. A doula, whom we love, are non-medical professionals who are trained to offer emotional and physical comfort and support to a laboring mom throughout labor and birth. And I do want to sneak in a little tidbit here. As everybody knows, with COVID-19, unfortunately, a mom's amount of visitors she can have during labor and birth are limited. However, we are still welcoming our doulas to come in and are thrilled to work side by side with them if that's the mom's desire to have a doula at her labor and birth.
So that's great to understand. And I'm sure that that's going to be helpful to a lot of people. I personally did not know the difference. I thought it was maybe just a different word for midwife. So that is very good to understand. So last myth, midwives cannot prescribe medications or test orders.
Okay, so certified midwives are licensed to prescribe a full range of medications and treatment. We can also order needed medical tests and procedures within our scope of practice. I do think it's important to note here, I think a lot of women are under the assumption that if they have a midwife during labor and delivery that they can't have pain medicine. Completely not a fact. If a mom decides that IV medicine or epidural anesthesia is really what she desires for her labor, we absolutely will support her in that decision.
Awesome. So we've learned a lot today about what you do and some of the services and care that you have to offer at Spectrum Health Pennock. And I hope that everybody else has learned a lot too and takes advantage of this information. Let's see. I do have a couple more questions. Can you tell us a little bit about what it looks like to have a visit with you at Spectrum Health Pennock Integrated Care Campus?
Absolutely. So when you schedule an appointment with me at the ICC, you will have an appointment just like you would with any other provider. We provide full scope pregnancy care all under one roof, which means we have lab here, we have radiology, where patients get their prenatal ultrasounds. So I feel like this is very convenient service to offer the people of Ionia. I do want to make note that when it is time to have baby, our patients come down to the Family Birth Center in Hastings for delivery.
Okay, that's awesome. That's good to know. Can you tell us more about the birthing center?
Yes, so our Modern Family Birthing Center is located within Spectrum Health Pennock Hospital in Hastings. We offer private labor, delivery, and recovery suites. So what that means is there's no packing up and being shipped off to another unit or room once baby is born. The family gets to stay in the same room for the entire admission. Our Family Birth Center offers a wide range of resources and amenities to laboring moms, which includes birthing balls, birthing chairs, bean bags. We have a wonderful large jetted jacuzzi tub that is great for natural pain management in labor that lots of our moms use. We do have our own OR suite on the unit, so it's specific to our patients who either have a planned C-section And I do want to make note that we have an excellent nursing staff on our unit. They're very experienced, and they will be there to provide one-on-one care with our patients as they're going through the labor and delivery process.
Sounds like you guys pretty much have it all.
I think we do. I may be biased, but I think we do.
Yes. Well, you did a fantastic job today educating me and the viewers and the people of Ionia on the midwife myths. We busted through those and we learned some of the services that are available to us right in our backyard. So I hope people take note and feel free to share this information with their friends and family. Send them over to see Carey or one of her other. You said they were both nurse midwives. Was that Jessica and I'm sorry.
Jessica Travis and Renee Gasky are the other two midwives in our practice. I am primarily in Ionia, so you pretty much can expect to see me in the Ionia campus.
Okay, wonderful. Well, Carey, thank you so much. You did a fantastic job today. See, it wasn't nothing to be nervous about. You did.
Well, great. Thank you for having me. I really appreciate this.
I do have just one more thing before I sign off. You're welcome to sign off now or hang out. I'm just going to make a quick announcement to the people of Ionia. We're signing off until next week. Have a great one.